So we're going to do kind of an unusual taping today. We're going to actually tape the Flexor Hallucis Longus. Now you'll see a lot of problems in this with a multitude of athletes and other folks, dancers in particular, because they tend to like to live on point. Okay, so they're really shortening the Flexor Hallucis Longus, which originates off the back of the fibula and the tibia, and will actually come around under the medial malleolus, under the navicular, and then into the great toe. And so oftentimes you'll see, as when I passively go up with the foot, how this toe is going to want to drop. And what happens is you'll actually feel the tendon for the FHL being really tight. You also note that sometimes patients will have a tenderness on the medial portion of the calcaneus subtalar joint, and so when you press in here it can be quite tender, but very often they'll be very taut right here under the foot, and you'll see this toe drop. So we'll actually put stretches onto our patients. And what I like to do with this is, I took the tape off a moment ago so I could retape for this video, so it's already been cleaned, but I'm going to literally twist and tear my tape, take this end off, and I want to put it at the base of the great toe, okay? And then I'm going to kind of leave this area so they can bowstring the tape. Then I'll pull the tape off, and I'll kind of go over to the posterior lateral portion for just anchoring purposes. Paper off tension, which is approximately 10%, and then I'm going to tack this down. Now what I'll notice then is you won't notice a big difference in the toe when you go up into passive dorsiflexion, okay? But one of the things that we will typically notice is a reduction in pain a little bit when we push onto the the inside of the foot. Now this is really good for somebody who has really chronic tendinitis in here. Sometimes this can be mistaken for plantar fasciitis when you push into these very similar areas. But this will work very nicely for someone who has flexor hallucis longus or FHL tendinitis. And again, paper off tension, 10%.